நம்ம ரெக்கார்ட் முதல்ல கொடு.
கொடுத்துட்டு
ஸ்டார்ட் பண்ணலாம். சரியா?
கொடுத்துட்டியா?
ரெடி பண்ணிக்கிறேன். இப்போ ஒரு சாப்டர் இல்ல நீ யாரா இங்க உட்காரு. நாங்க ரெண்டு பேரும் உட்காரோம், நீங்க ரெண்டு பேரும் உட்காரு. யார் क्वेश्चन கேக்குறாங்களோ எல்லாத்தையுமே கவர் பண்ணுங்க. சரியா? ஏதோ இது பண்ணிட்டால எடிட்டிங் இல்லாமலே பண்ணுங்க. ஸ்டார்ட் பண்ணலாம். ரெக்கார்ட் கொடுத்துட்டியா?
கொடுத்துட்டேன்.
கவர் ஆகுதா பாரு.
ஆகுது.
தண்ணி ஃபேஸ் தெரியுதா?
தர்ணி ஃபேஸ் தெரியுது, லூபி ஃபேஸ் தான் தெரியல.
கொஞ்சம்
ஓகே, எல்லாரும் ஃபேஸ்
அந்த வாய்ஸ் எல்லாம் ரெக்கார்ட் ஆயிடும்.
எடிட் பண்ணி
சொல்லலாமா?
இப்படி பண்ணும்போது பார்த்துக்கலாம்க்கா வாய்ஸ் இப்போ.
Okay. Good evening, sir. We are coming from Simalkar Engineering College and we are taking part in an event called Information. So in this task, we need the details regarding telemedicine. So can you please introduce yourself, sir?
Yeah, myself Dr. Lokesh, working as assistant professor in the Department of General Medicine at Mahatma Medical College. Yeah, that's about.
Okay. So what's with the telemedicine?
Telemedicine is just like a television, like it's a mode of communication. So in India, if you see grossly, we have majority of the population being in rural area. So some sort of specialization is required for treatment of this rural patients also. So ultimately the problem is we won't find each and every specialist in the rural population. So there will be a primary healthcare doctor. So he will deliver whatever the minimum treatment that is required. So if anything in advance if it is required, then there will be a mode of communication between a doctor one who is situated in a rural place with the doctor or a specialist one who is situated in the urban area. And this communication will be in a form of telephonic sort of communication, or it may be either audio visual also through various internet webcams like that. So in a peripheral area, if they are finding difficulties in treating a patient, critically ill patient, so either any sort of investigations that is being taken at that peripheral site will be through a camera, will be transmitted to the doctor or a specialist one who is situated in the urban area. So he sees it through the camera and he will advise what probably the disease that the patient is suffering from, what basic medication he can rather give, rather than just referring the patient to a city center. So that may take quite long time. So in the wean process, patient may have a lot of problems. So this rather delivers specialized treatment at a distance, at a locally situated or a what you say, a rural area mainly. So where we usually don't find a specialist or a super specialists. So this helps in rather giving a much better medications within a short span of time. So it rather reduces a lot of time gap that is being situated or elapsed between the time of the patient being received in the rural area till he gets transformed to a bigger center where he can have specialized treatment.
How is the government involved in this telemedicine?
Government also takes active interventions, but since, as you know, India is basically a rural country, so the reach till the rural places, it takes not only the government activities as such, but it also should involve various NGOs. So government is actively being involved. So various medical colleges have been attached for this telemedicine purpose. So there will be a team of doctors who will be placed in the hospital, and as you know that there are smaller health centers that is being created by government in rural areas. So there will be a basic qualified doctor who will be situated there. So he will be made to communicate with the specialist one who is situated in the bigger hospitals. So if you see, whatever the government has taken action, but the ultimate effect may be hardly 5 to 10%. So rest of the things has to be still backed up.
It's not possible to save all the patients.
Yeah.
Yeah. Okay. What's the current scope of telemedicine in India?
Current scope, if it enlarges, it is really good for the benefit of the needy patients who are really poor. And as you also know that once it becomes night,
Okay.
so most of the transport facilities are down, especially in district as well as in towns, especially in villages. So in such situations, from the time the patient finds it an access to a major center, he requires certain medications, at least life-saving minimum medications. So those medications, so that rather prevents this time lapse. So in that process, it will be really helpful. It's not only for the emergency cases, but also for health education also this can be used. So they can organize a small camp at the peripheral area, and that gathering can be addressed by a specialist who is situated in the city center through a telemedicine. So it's not only in treating the patient, but it can also be used as a health education purpose for various activities.
Okay. Is there awareness regarding telemedicines among the latest students, college students, medical college students?
Medical college students, yes, they have been exposed for this as a curriculum part. They are during the 1 year of internship, that is final training after they complete their MBBS course, they will be exposed to this telemedicine. But ultimately, it should be the communication. The centers for this telemedicine are really lacking. So if you find each and every institute will hardly have one telemedicine unit, and that telemedicine unit may function once in every fortnight or once in a month. So that doesn't happen on a regular basis, day-to-day basis. So if that has been taken care of, then telemedicine will expand very nicely.
In your point of view, is the telemedicine is needed for Pondicherry?
Definitely it's required.
Okay. Stop it. You are
I'll be at you.
Difficulties you face in transmitting the signals from stage?
It's basically the communication has to be clear between the peripheral center and the centrally situated centers. So when the mode of communication is mainly through the audiovisual inputs, through the internet. So if the internets are down, so then it creates a problem for communication. Either the doctor at the primary center may not be able to reach the person in the city center, or the person in the city center may not be able to interpret what exactly is he wants to know. So there will be communication gap. So this itself will delay the process of this telemedicine. And one other thing is like in peripheral centers, you know, most of the government centers, whatever we come across, we don't come across this laptops or the desktops being provided by the government. So if that is being taken care of, then it will be helpful for better hearing of this telemedicine. And another thing is this misuse. The misuse of this internet facilities, if it is being given to a peripheral center, that has to be taken care of. So if these things are taken care of, then with active participation from the local administrators and doctors and the community, then it will be a very good success for this telemedicine.
Till now there is any active participation with the government organization?
Usually, this telemedicine will have tie-ups either with the government setups or with the NGOs or with the private hospitals. As per the existing guidelines, so each and every medical college will have access to 4 to 5 primary health centers. So if the medical colleges are actively involved in this, so then there will be a definitive communication that will be existing between the institute and the peripheral centers. So the communication will be either with the peripherally situated government health centers with the government institute, or primary health centers with the NGOs, or PHCs with the corporate setups, or with the private medical colleges.
This telemedicine has reached its peak in every of the institutes, or it needed to be improved?
No, it's all in the initial phases. So it has to be grossly improved, and the awareness among the people also should be increased. So not much people are aware of this particular entity as such. So once
telemedicine has not been improved in India or all over the world?
in developed countries it has been improved. So it's mainly the problem with the developing countries.
In your point of view, also reason behind this lack of awareness and
That's what, lack of awareness is one thing, because not many people are aware of this telemedicine that is being available. So if the awareness has been brought about by either through other means, by either through newspaper or by television programs, then if the people are aware of whatever is been happening, and if definitely if they require any help, then they can contact the regional centers and they can get the benefit of it. So awareness has to be created.
you have experience of attending the telemedicine?
Yeah, I've attended few telemedicines.
Can you please share the experience?
Usually, like one other drawback is like the city centers, the places where we are situated. We usually work between 9 to 4 or whatever the timings in the daytime. But night time, if at all if there is any necessity, then the doctors may not be available at that particular time. So until unless they create a telemedicine center which functions round the clock and having the specialist doctors available for this particular purpose, then there will be some gaps, so which may not be actually filled up. So this can be actually used for management of acute emergencies, or medically or surgically ill patients, trauma cases, as well as for creating health awareness among the population. And whenever the natural disasters occur. So initial phases, whenever we come across these disasters, the telephonic contacts as well as this internet will be down. So once that is been established, still we may come across many of the population being suffering from either injuries or with some infectious diseases. They may not have access for the regular food or for shelter. So that also can be taken care of whenever this telemedicine is being established. So it's not only for treating the patients, it can also be used for health awareness as well as in managing the bulk number of cases whenever we come across this natural calamities.
Can you please give us any tips to spread the awareness?
Awareness, that's what, as I already told you, the awareness through this newspaper as well as local television channels will be a best way of making the people aware of this telemedicine.